AM 1220 KHTS. Carl Goldman with you on this beautiful, this is like a Chamber of Commerce Saturday out here. You cannot ask for better weather, a nicer place to live. Santa Clarita, it is happening throughout Santa Clarita and most importantly down here in Old Town Newhall on Main Street. We are going to be taking a special 1 hour right now and delving into plastic surgery, cosmetic surgery with Dr. Justin Heller. If there's anything you want to know about plastic surgery, cosmetic surgery, breast augmentation, liposuction, the whole gamut, you are going to want to stick around for the next hour. We're also going to be opening it up to questions from, and there's been a number of our listeners wrote questions ahead of time because we pushed out that you were going to be here, Dr. Heller, and there's some interesting questions, and hopefully we'll maybe do Stump the Plastic Surgeon coming up in a few minutes.
I look forward to it.
Yeah, I'm sure. You were our guest about 6 months ago, and it was the first time I have ever done an interview with someone involving plastic surgery, and I learned an awful lot, so much so that I'm now doing intricate surgery. No, not quite yet, but I learned a lot, and we're not going to go through the whole same list of information that we did 6 months ago, but one of the things that was most interesting for me, and I thought we'd start with Plastic Surgery 101, is what's the difference between plastic surgery and cosmetic surgery?
So first, thanks for having me again, Carl. This is great. I think that is probably, for whoever is listening, is probably the most paramount thing that they take away from this. A plastic surgeon in experience is a completely different track than a cosmetic surgeon. What a cosmetic surgeon essentially means can mean a number of things. It can mean anything from a weekend course to a 1-year fellowship. It can be done by any physician, meaning emergency room doctor, internal medicine, even people that haven't formally finished could still call themselves that category. So there is no true definition of what a cosmetic surgeon is. A plastic surgeon typically means that you finished general surgery residency and then gone through additional training in plastic surgery, which in total usually amounts to about 3 to 5 years of designated training in plastic surgery, from basically an aesthetic standpoint, learning about all the different areas, what's aesthetically pleasing, what things should look like, symmetries, basically just a focus on that. Usually it also amounts to thousands and thousands of procedures. For myself, being a plastic surgeon meant general surgery, plastic surgery, and then several fellowships after that, which were each a year long, which accumulated in over 14 years of total training. So the road to being a plastic surgeon and the road to being after that a board certified plastic surgeon is quite in depth. And so if somebody's going out and looking for somebody who truly has been trained, you want to make sure that they've appropriately been trained in the procedures they're trying to basically talk to you about. Additionally, you want to make sure that they have board certification, and usually you want to look for a board certification in plastic surgery. What that means is that after they finish all that training, their peers have tested them and basically recognized them as being appropriately and capably trained to do the procedures they're mentioning.
So that's a giant difference between a plastic surgeon, cosmetic surgeon, and Dr. Heller, you're being modest by saying your training came from some pretty prestigious places. Why don't you share that?
Well, I trained at Yale, I trained at UCLA, I trained at UCI, and down in UT Southwestern. Each were basically the foremost programs in what I was training in. The environment that I was able to train in was phenomenal. Basically, I did specializations in craniofacial surgery and Mohs surgery. Many people won't know what Mohs is, but that's more in reconstructions of defects of the face caused by cancer. Craniofacial is reconstructing the face, which has made me a much better aesthetic plastic surgeon, from facial facelifts, nose reconstruction, nose jobs, chin augmentation, fat grafting, understanding how to fix the most deformed of individuals and bring them back to an aesthetically pleasing form has really influenced me in terms of when I do aesthetics now as well.
And you said those institutions are all tremendous institutions when it comes to your training. Challenged a little for football, but doing fine in terms of training. Yeah.
Well, Yale for sure is challenged in football. I'll agree with you there.
AM 1220 KHTS. Carl Goldman with you, along with Dr. Justin Heller, Heller Plastic and Reconstructive Surgery. They are the local team here. They are anchored here in Santa Clarita. Dr. Heller lives in Santa Clarita with his family. Your offices are over on Valencia Boulevard, right next to City Hall. And you have an incredible website with HellerPlasticSurgery.com. So we mentioned the difference between plastic surgery and cosmetic surgery. What about reconstructive surgery? What's the difference?
So reconstructive is probably some of the most rewarding work that we do. What a reconstructive surgery means is that either someone's been in an accident, they've gone through cancer treatment, they've gone through different modalities of life that have affected them adversely, and then they present with these issues, whether it's absence of their breast, a defect of the mandible, a nose that has basically sunken in from a tumor, all sorts of different issues that we see, from missing ears to you name it. And those kind of patients, they come in and they don't know what can be achieved, but with multiple surgeries and staging things, we're really able to bring them back to, bring back their self-esteem, bring back their confidence, and get them out to where they're happy going about their day and don't recognize that there's anything that ever was missing.
Would burn victims also fall into that?
Yes, quite a bit of burn victims fall into reconstruction. There's burn centers as well that deal with the acute things, and then the burn, usually post-acute is what we see on a more regular basis.
On the emergency side, however, they're not calling you into the ER right away usually. You're going to be working with the patient after there's been a time for recovery, right?
That's correct. Probably about 10 years ago, I would be the one they would call for all the emergencies in probably the greater LA area. And about 7 years ago, stopped taking that call, but still have a very wide referral of the truly complex reconstructions. In fact, one of the major reconstructions that I did early in my career was worked on the first face transplant, and that was exactly what you're describing: electrical injury, burn, person lost his face, and we, over hours and hours, were able to basically salvage his life, and then go from there and proceed with the facial transplant later on.
How long did the facial transplant take?
Well, the first surgery actually took a little bit longer than the facial transplant, which was what we call 4 free flaps, and that took about 40 hours continuous.
Wow. Wow, talk about marathons.
Yes.
That's pretty incredible.
I took a 2-hour power nap.
Yeah, I would. I hope not during the surgery, in between.
Yeah, in between.
A little rest.
Yeah,
a little
in between.
Dr. Justin Heller is our guest here on AM 1220 KHTS. Carl Goldman with you. Dr. Heller, head of Heller Plastic and Reconstructive Surgery here in Santa Clarita. Their phone number, and I'll give this out later on as well, is of course here in Santa Clarita, 661-434-0092, 434-0092. But I encourage you to check out and just Google Heller Plastic Surgery, and you'll see his website coming up, and it's one of the top websites in Santa Clarita. In fact, you were named best Santa Clarita surgeon, for a plastic surgeon here in Santa Clarita by our friendly competition, the Signal newspaper.
Yes, we recently won that award, and it means a ton to me and to my staff, because really what it means is that our hard work and how we feel about the people and our patients in Santa Clarita really is felt the same and reciprocated. I know my staff and we give our own phone numbers. We're available nights and weekends. We're always available, not only from a professional standpoint, but from a personal standpoint. So, I always went into medicine hoping that whoever we see or whoever I treat would be treated the same way I would treat my family, and I think that's really what I see in my office as well, and it means a lot to have that recognized by the people of Santa Clarita,
and that's
especially
very, very
living
important.
here.
Right. And I understand also you named best plastic surgeon up in the Antelope Valley as well, and wherever your offices are located.
Yeah, each office location, when I first started, I had multiple office locations, and then I actually had children about 4 years ago, and then really centralized back closer to home. But each
in fact, you just had a child in between our last interview.
Exactly.
Congratulations.
Thank you. So when I came back closer to home, I basically, we focused here, but we've been very fortunate. Every office location has one best, and that's always voted on by the people. And each time we win, it means just a tremendous amount to me.
Well, it says a lot, and my best friend and the best friend for any interviewer has got to be Google, and it's a great information source. But also, if you Google plastic surgeons, there's a few that are from outside the area that have snuck up there onto that first or second page. But you're right up there toward the top with lots of recommendations, and you can tell that you're anchored here in Santa Clarita, and that's important. And speaking of Google, we looked at the top 5 questions, and Aaron's here learning more than he ever thought he was going to learn about plastic surgery today, our engineer. But
everything I've wanted to know and more.
There we go. But I'm going to share the top 5 questions that you should be asking a plastic surgeon, and we're going to ask Dr. Heller right after this short break. Your hometown station, AM 1220 KHTS. Stay with us. Your hometown station, AM 1220 KHTS. Carl Goldman with you, this special 1-hour program with Dr. Justin Heller. He's the top plastic surgeon, we could say that, voted by here. We can vote him here at KHTS in our studio, but also the
he's got my vote.
He's got your vote, but the Signal newspaper definitely voting him in as the top plastic surgeon in Santa Clarita. HellerPlasticSurgery.com. HellerPlasticSurgery.com. They're located over on Valencia Boulevard, right next door to City Hall. Phone number 661-434-0092. Before the break, we were talking about our good friend Google and what the top 5 questions are for a plastic surgeon. And so I thought we would start out and just run down those 5 and get to know you a little bit better. Maybe Google will stump you. Maybe not. We'll find out. The number 1 question on Google is, how frequently do you perform the procedures I want?
So that's always a question that a lot of patients ask me, and to be frank, the numbers are usually extremely high depending on which procedure it is. Facelifts, hundreds and hundreds at this point. Breast augmentations, likewise. So there's a multitude of plastic surgery procedures that we do with great frequency. It just depends. One of my favorite procedures, honestly, that we do on a regular basis is like upper and lower eyelids. We do those in the office all the time. The nice thing about them is it's such a rapid recovery type procedure that within 5 days sutures are out, 7 days makeup are on, and just really rejuvenates the whole face. So I think we're probably 600-700, maybe more at this point. When I was in Dallas, I did over probably 6,000 procedures in total. So, and there was a multitude of different areas where those were in. So.
And no gray hair yet.
Well,
so you've got you've got a lot. No, but you've done a lot of surgery, and you're still quite young, certainly compared to me.
My wife seems to be able to find them, but I guess I did good work on myself.
Yeah, definitely. Unlike me with a losing battle with the hair. Eye surgery, eyelid surgery, why are people coming in for that? What's the most common cause?
So there's 2 really common things that we see. The lower eyelids, usually you'll see bags underneath the eyes. So both men and women, we both have it. And, the prevalence is almost equal at this point. Men are much more comfortable as well now coming in and really doing a change in terms of their appearance. It's what makes you look tired through the day. And via a simple hidden procedure, you can basically get rid of the bags, tighten the membrane, and really make that area look young again, reverse it 10, 15 years ago to where it was. The reason it happens is because over time, we constantly have a load being put against it. We're blinking on it, and the little membrane has fat behind it, and that fat, over time, as the membrane weakens, pushes itself out and creates a little shadow, and that shadow is seen as the bags under the eyes. So by restoring that membrane to where it was and getting rid of a little bit of the fat and a little of the extra skin, you're able to restore that whole lower eyelid looking more youthful. Upper eyelids, kind of the same idea. However, the upper eyelids seem to be a little bit more symptomatic, and some people may not even realize it, but when you look at somebody's eye and you look at the outside of the eye, what you really see is, you can sometimes see as we get older, you can see what we call hooding, which means that the eyelashes themselves have skin resting on it. And that area of hooding is because our brow, which is on the forehead, is starting to settle down. In addition, we've blinked so much that we've stretched out the tissue. So by the end of the day, holding up that extra skin so that we can see, particularly in the outside, tends to make us overly tired. And that's a common complaint for the upper eyelid. People come in, they feel tired at the end of the day, they're just feeling exhausted, and it's because all day long their forehead's being worked and worked to try to lift that skin off. So that's a very easy procedure. We get rid of the skin, any extra fat, we hide the incision so it's not seen at all. It heals beautifully. Sutures are out 5 days, 7 days. You can use a little cover up, and most of the bruising's gone even if you don't.
It's interesting that you are saying that just as many men are coming in for this procedure as women, and I see there is, and we'll talk about this a little later, but there's a trend now with men coming in and doing more and more cosmetic plastic surgery.
Yeah, more so than ever now, I see men and women both coming in. In fact, I often see couples coming in together, and they both have their own unique things that they want to address. Men tend to be more oriented around liposculpture. Getting the younger men tend to want like abs and things kind of carved out. It's the areas that would be resistant to even heavy workouts and things of that sort. As we get older, men want their eyelids, they want their faces looked at, their little turkey gobble underneath their neck. Usually with men, it's all about getting a fast recovery. So we want to get back to our routine. We want to get back to doing things as quickly as possible.
So with the eyelids, is that a fast recovery as well?
It is. It's about a week. So they can go out the next day and go to the mall with just sunglasses on. So it's very conducive to that recovery process that we look for.
And do they get both done at the same time?
Usually uppers and lowers go together, but not in everybody.
I mean, both eyes done at the same time for the lowers.
Yeah,
yes.
Definitely.
Yeah. So do both, and do you then have a patch over your eye for a certain amount of time?
Oh no, you're seeing normally. There's no issue. Like I said, even immediately after the surgery, you could go out, and I wouldn't suggest driving home immediately after, but the next day you can get back to your routine.
Interesting. Okay. Now moving over to our friend Google again. Question number 2 is, what will recovery be like? And obviously we just talked about that for the eyelids, but generally I guess that runs the gamut depending on what kind of surgery. But
sure,
what Google I think is asking is, it's important to ask that question, what will recovery be like? And I suspect most of your patients coming in before you do a procedure will ask that question. If not, you're going to certainly share that with them ahead of time.
Absolutely. And recoveries are different for different procedures, but every procedure we do, we really try to make it as rapid as possible. And there's several ways that I've kind of approached making it that way. The first is doing a really clean surgery, which means that there's no extra bleeding, there's no extra bruising. The bruising and bleeding are going to cause inflammation and pain. So when you see people afterwards and they're in extreme pain, that's usually because what was done may not be as cleanly done. The second thing that you really try to do is, we try to do as minimally invasive of approach as possible, which means not over dissecting, making sure things are really done in a manner that, you can achieve the results, but achieve it with less invasivity, if that's a word. The final thing is, I've managed to make a lot of these procedures painless by using supplementations, whether it be herbal medicines or even medication that I administer during the procedure. For instance, I can basically do a breast augmentation with very little pain. The way we are able to achieve that is doing the surgical techniques we described, but then we administer a local that just came out that works for about 3 days. So that local makes the first 3 days relatively painless, and then as that local wears off, then the pain's already down to day 3. So now it's a much more comfortable position. Tummy tucks, same thing. They can get up, they'll get out of bed the first day, they'll be walking around the first day. I tell them to take it easy. I make sure they do that regularly, but we can make these procedures a lot more comfortable. Liposuction, likewise, same thing. You give the medication in there, put them on certain anti-inflammatories and pain medicines, and those can also make these procedures very rapid recoveries.
Are there things we can do ahead of time in preparation for the surgery that will make it an easier go for us?
Usually it's preparation, in terms of knowing what to expect. And I think it's more about patient education and really letting them know the things that they can do, letting them know the things they can't do, things you should eat, things you shouldn't eat. The first 24 hours after surgery, you may be a little nauseous, so have a soup ready so you don't have to go make a soup that night. By the next day, you should start feeling better. Depending on the procedure, usually most of my procedures by 1 week, you're feeling great. So for instance, a facelift, by 1 week, most of the bruising's gone. They're back to their routine. There's very little recovery after that. Likewise with the eyelids. Tummy tucks, it's a little bit longer just in terms of heavy lifting, but we get them back usually to their full routine. They're up and walking the first day, but their full routine usually within 3 to 4 weeks, they're getting back into it.
I know my two best friends are chicken noodle soup and Jell-O.
Yeah, absolutely.
Jell-O is
absolutely.
And
saltine crackers.
Saltine crackers work really, really well. The potential risks and complications is definitely a question you would want to ask your plastic surgeon before coming into and starting surgery, and I'm sure you get that asked all the time.
Yeah, absolutely. So, every procedure has a risk and complications, and really it's up to the surgeon really to figure out ways to make those almost non-existent. That's our goal. So, in my practice, knock on wood or knock on my head here, essentially what we try to do is we look at any risks. For instance, if there was a risk of infection, we treat with antibiotics ahead of time. I've never had an infection in my practice. Risk on tummy tucks, there's a risk of seroma. I've never had one because of the techniques I use in terms of how we suture things closed. There's a risk of early capsular contracture. They certainly can happen, but I haven't had one because of the techniques we use in terms of being bloodless on a breast augmentation, putting it underneath the muscle, choosing a textured implant. There's a number of different ways and approaches you can use to really get those complications to as low as possible. They do exist. I tell everyone they exist. I tell people, 95%, 99%, I'll hit it out of the park. We won't have a problem. There's 1% of the time that we may, but thus far in my practice, that has really been minimal.
AM 1220 KHTS, Carl Goldman with you. We are talking with Dr. Justin Heller, going through the list of Heller plastic and reconstructive surgery. We're going through the Google list of the top 5 questions to ask your surgeon before going in for surgery. And right now we're up to question number 4, and that is, where will my surgery take place?
So this is an important question as well. The surgical procedures I do is my decision on where to do it is usually based on the length of time and the care that's going to be needed afterwards. So typically, if it's a smaller procedure, an hour, 2 hours, a relatively straightforward young and healthy patient, then of course it could be done in a surgical center. We do them here locally, so that means either at Summit Surgery Center, Henry Mayo Surgery Center. We like to use both of those surgical facilities quite frequently. We also can use other facilities depending on where the patient's coming from. I also have multiple hospital privileges, basically from here all the way through Long Beach. So depending on where the patient's coming from, where I'm going to be, we make decisions together and make it convenient for them. When we want to do a bigger procedure, that's going to be longer, then we'll keep you overnight in the hospital so that we can have nursing staff and people available to help you, make sure that everything goes comfortably, make sure you're comfortable for the first day so that when you're going home the next day, you have all your questions answered and you feel at ease.
And actually, you preempted me because you answered the fifth question of Google, but I'd like you to elaborate on it a little bit, and that is hospital privileges for doctors. So not all doctors have hospital privileges, and not all hospitals are open to every single doctor out there, correct?
Yeah, that's correct. In fact, a number of people, as we referred to earlier, that call themselves cosmetic surgeons will actually not have hospital privileges simply because the hospital usually requires board certification to get those privileges as well, and their credentialing may be in a specialty that's not recognized by the surgical facility. So some cosmetic surgeons can, such as ear, nose, and throat, because they are a surgical specialty, but a multitude cannot. So what I see occasionally, and fortunately fortunately we can usually handle it, but what ends up happening is that some people will go to a cosmetic surgeon, have a procedure, end up with a complication, and then present to the emergency room with this complication with a cosmetic surgeon that can't help them or not capable of helping them, and then relying on an outside physician to try to step in and help.
Yeah, you do not want to use those mobile cosmetic surgeons that are traveling around Santa Clarita. I'm kidding.
No, I'm pretty grateful that we don't have too many of those.
Yeah, no, it's the doctors here, and of course the major hospitals around the area, whether it's Henry Mayo, Providence, Holy Cross, are great institutions, and most of the doctors here are connected with one or both of those hospitals.
Right. That's something that you do want to make sure of, is that the physician has privileges at your neighboring hospital.
And you, I take it, have privileges at those hospitals.
I do.
Correct? Yeah, good. Dr. Justin Heller is our guest here on AM 1220 KHTS. HellerPlasticSurgery.com. I urge you to go check it out. All kinds of great information over on that website, HellerPlasticSurgery.com. Dr. Heller's offices here are right on Valencia Boulevard, next door to City Hall. Phone number is 434-0092, 434-0092. We're going to take a short break. When we come back, we're going to delve into your questions for Dr. Heller. AM 1220 KHTS, your hometown station.